All right, guys, so good morning and welcome to our presentation. My name is Britannia. This is Olga here. We've also got Amy, Sam, and Isabel. Today, we're going to be talking to you about doing a community health assessment for Placer County, specifically focused on pneumonia and flu in adults over 65. Just to let you know, we are going to be turning off our video section during this presentation due to our limited bandwidth with our internet. But we will be coming back on camera at the end to allow for a Q&A session. There's my camera.
Okay.
It doesn't allow me to shut off my camera. Okay, maybe we'll be leaving it on. All right.
Okay.
Yep. You're up.
Okay. Hi, I'm Isabel. I'll be introducing the project, so let's see. So we want to talk a little bit about what the flu is. So the flu is a respiratory illness that's caused by different viruses. It can infect the nose, throat, and sometimes the lungs. It spreads person to person through little droplets in the air when you cough or sneeze. Young children, older adults, and those with chronic medical conditions are at higher risk for complications, including sinus and ear infections, organ dysfunction, sepsis, and pneumonia. We wanted to talk a little bit about the difference between influenza-like illness and the flu. So influenza-like illness describes a set of symptoms that are common to many upper respiratory tract infections. So this includes fever, a cough, sore throat, and it's not attributable to any cause. So the only way to know whether it's the flu is to do a laboratory test. Okay, and we have a little graphic. This is to explain the difference between the cold or the flu. Main differences are fever, aches, and chills that you would get with the flu and maybe not with just the common cold. And now we want to talk a little bit about pneumonia. So pneumonia is an infection of the lungs that can be caused by many different things, including viruses, bacteria, or fungi. This causes the lungs to fill with fluid. It can be community-acquired, healthcare-associated, or ventilator-associated, and we'll talk a little bit more about this in a few slides. Complications of pneumonia include respiratory failure, organ failure, and sepsis. And here's a little picture to show you what happens when you have pneumonia. So A is what normal lungs look like, and as you can see in all of the other ones, there are a lot more white spaces in the X-ray, and that's fluid, which is not good. Your lungs should be full of air and not fluid. We'll quickly go through the different types of pneumonia. So there's hospital-acquired pneumonia, and this is picked up during a hospital stay and is often the most severe out of all of the types. There is ventilator-associated pneumonia, also acquired in the hospital in those who are on a ventilator. We also have community-acquired pneumonia, and this is acquired in the community outside of the medical setting. So this would be picking it up, at the gym or at the grocery store or something like that. And then we have walking pneumonia. And so this is cold-like symptoms, a low-grade fever, but they're often more mild symptoms, and it often goes undiagnosed. And here's some common symptoms of pneumonia, including sneezing and runny nose, a sore throat, a productive cough, and things like fatigue and muscle aches. And here we have some risk factors for pneumonia. So older adults, age 65 and older, those with chronic illnesses, such as lung or liver disease or asthma, those with conditions that weaken the immune system, so somebody who might have HIV or cancer, and behaviors like cigarette smoking put you at a higher risk for getting pneumonia and falling ill with complications of pneumonia. So the reason that older adults are at higher risk for flu and pneumonia and complications related to flu and pneumonia, they're more likely to have comorbidities that increase their risk for complications. They also have a weakened immune system. Pneumonia is the third most common cause of hospitalization in adults 65 and older. And here's a little graphic that highlights how much higher the risk for flu-related complications is for older adults. And so we wanted to highlight the big ones, including increased risk for heart attack and stroke. Older adults are 6 times more likely to die from flu-related complications. And here we have a little chart that shows how much higher the death rates are due to flu and pneumonia in adults aged 65 plus. So in the age group before, the rate is 8.3 per 100,000, and that jumps to 107.4 deaths per 100,000 in adults 65 plus. And here is just to highlight even more that the older you get, the higher the chance that you die from flu and pneumonia. So in this group, in adults aged 85 plus, the risk is much higher that you will die if you contract flu or pneumonia. And quickly, we wanted to go through a comparison of the 2 counties that we will be talking about today. So we chose San Luis Obispo County and Placer County to compare the prevalence of flu and pneumonia. So here are just some demographics of the counties overall. They're very similar in terms of population, including adults over 65. They're also very similar in terms of education level and median income. And Placer County has a slightly higher median income and more dense population distribution than San Luis Obispo County. This graph here highlights the poverty rates of each county compared to the US as a whole. So as you can see, San Luis Obispo has a significantly higher poverty rate than does Placer County. And these graphs here compare the race and ethnic breakdown of each county. They're almost identical in terms of diversity, with a majority of both populations being Caucasian. And now we'll transition into flu and pneumonia in each of these counties. So this is a chart here that compares the rate of deaths from flu and pneumonia in both of these counties. Both of them have lower mortality rates than California and the US, but Placer has a slightly higher mortality rate than San Luis Obispo. So more people in Placer County die from flu and pneumonia than in San Luis Obispo. This graph here compares the rates of hospitalizations due to community-acquired pneumonia, and San Luis Obispo has a slightly higher rate of hospitalizations than Placer County. Some of the biggest contributing factors to flu and pneumonia prevalence are pre-existing medical conditions. These conditions include respiratory conditions such as asthma and COPD, and this chart compares the rates of each of these in Placer and San Luis Obispo, and as you can see, they are very comparable. Other medical conditions that predispose someone to an increased risk of flu and pneumonia complications include cancer, chronic kidney disease, heart failure, diabetes, and as you can see by this graph, which compares all of these across both counties, Placer has slightly higher rates of all of these chronic medical conditions. And finally, there are many other factors that may contribute to rates of flu and pneumonia and subsequent complications. San Luis Obispo County has a slightly higher percentage of the population that smokes. They are less active and are uninsured. However, there are more physicians per person, and San Luis Obispo has slightly higher rates of annual flu vaccinations. So beyond all of that, there are also health determinants in each county that might predispose the population to contracting flu and pneumonia. And now Sam is going to prevent these health determinants for each county.
Hello, everyone. So we're going to go ahead now and break down the population relevant determinants in each county and then analyze them at the end. So first off, we want to take a look at Placer County. And a determinant are conditions a person's born into and influences in their environment. So there's two different types. There's social and physical. Physical are more natural, and social are more what's going on in that area that's more man-made or placed. First, we want to take a look at the healthcare related services and facilities. We see here there's 3 acute hospitals, 19 fire departments, 6 EMS providers. Specifically for the elderly now, we have 68 assisted living facilities and 19 independent living facilities. We have several different county senior services available in Placer County. And of course, we have different forms of transportation available for both elderly and general population, specifically through Placer County. Now to take a look at San Luis Obispo's population relevant determinants. Some similar numbers, some different numbers. For healthcare related facilities and services, we have 4 acute hospitals, 6 fire departments, 8 EMS providers, only 6 independent living facilities, and 49 assisted living facilities for elderly. Similar senior services available here. And specifically for transportation wise, we have the Senior Go transportation service, which is a transportation service specifically for elderly that kind of acts as a more affordable transportation taxi-like service. And now we have the physical determinants of health. These are more of the natural and built environments of the area. So parks, weather, borders, landforms, things like that sort. So first for Placer County, we have 36 public parks, communities that are built on rural areas and suburban living, and boundaries consisting of roads, highways, and train tracks. San Luis Obispo County, we have 15 total parks, a dense suburban living area, and similarly, borders created by highways, roads, but the coast for this county. And this kind of gives us a more idea of what the parks look like. And as we see here, Placer County's quite a large area. So there's parks reaching all around compared to San Luis Obispo County that has parks more centralized in one area. And now an analysis between these two counties, looking at these determinants, it shows us what sort of factors could have more of an influence on the general health of a population. So specifically here, we're looking at an elderly population, and we want to look at the amount of healthcare facilities available. So first we see both counties here have similar amounts of senior programs. On this little line here, it's about 5 for each county. Both counties have similar amounts of healthcare services with about 27 hospitals, EMS services, compared to around 18 for SLO County. And finally, we see that both counties do have a sufficient amount of healthcare services available for the elderly population of that county. But of course, now there are some differences to address as well. First off, you can see right here the dramatic difference between the senior living facilities in Placer versus SLO County. Specifically, Placer has 87 living facilities made up of both assisted and independent, while SLO County has roughly 55 of those living facilities available. A lot more parks in the county as well. We see 36 for Placer County compared to only 15 for SLO County. And finally, healthcare services, which we have 28 for Placer County with only 18 for SLO County. So now with these in mind, we want to take a look now at the policies that both of these counties have in place to help address these issues of pneumonia and flu with our elderly population, and Olga will be handling that for us.
Oh, as I mentioned, I'll be presenting some policies that are in effect in California, as well as some recommendations regarding flu vaccinations, pneumococcal vaccinations, as well as screenings. So according to the Center for Disease Control and Prevention in California, every healthcare facility has to offer flu and pneumococcal vaccines to patients over 65 who receive services at these facilities. And although this law doesn't directly affect the residents at Rolling Oaks, which is an independent living facility, it would affect them in the event they would require a higher level of care. Also, California was the first state to require long-term care facilities to provide flu vaccines to healthcare providers at no cost. However, healthcare employees can decline flu vaccines by signing a declaration. In contrast, in states like Colorado and Illinois, healthcare workers working in hospitals cannot decline flu vaccinations. Same as those activating in long-term care facilities in states like Arkansas, Colorado, Illinois, and Massachusetts. Furthermore, California Department for Public Health recommends that skilled nursing facilities should optimize influenza prevention and outbreak control intervention by having sufficient influenza vaccines and standing orders for administration, hand hygiene supplies, personal protective equipment, antiviral medication orders, and established a line of communication between the skilled nursing facilities and the local health department before influenza begins circulating the local community. Additionally, California Department of Public Health recommends education of the residents, of healthcare providers, as well as families regarding the importance of flu and pneumococcal vaccines in order to prevent a flu outbreak in these facilities. The recommendation includes screening each resident's vaccination status against flu and pneumococcal disease on admission and obtaining standing orders for pneumococcal vaccines from the resident's primary care providers. And in 2007, the Center for Medicare and Medicaid Services announced that nursing homes serving Medicare and Medicaid patients will have to provide immunizations against influenza and pneumococcal disease to all residents if they want to continue in the programs. The residents or the resident's family can refuse the shots, however, and those who cannot receive the vaccines for medical reasons are exempt. Under the final rule, nursing homes will also be required to educate the residents and their families about the advantages and possible disadvantages of receiving the vaccines. Likewise, according to National Conference State of Legislature, Medicare covers the cost of flu vaccines for all people over 65 years old. And now Amy will be talking about community services, health services, and access to care in Placer County as well as San Luis Obispo.
Okay, so just quickly looking at health and community services, we wanted to talk first about some of the vaccine clinics that are offered both in Placer County and in San Luis Obispo County. In 2020, Placer County offered free flu shot clinics to all Placer County residents. The clinics were both a drive-through and walk-in clinic that offered shots on a first-come, first-served basis. The clinics were only offered weekday afternoons, typically from 2 to 5 p.m. or while supplies lasted. The narrow time frame of availability may make it difficult for some in the community to access these services. However, this time frame may be more appropriate for the target population, as many may be retired, therefore having a little bit more flexibility in their schedule. 5 locations were offered throughout the county: Lincoln, Kings Beach and Tahoe, Auburn, Rockland, and Roseville, in which may make the service more acceptable to the target population in terms of choices available. Placer County made the information about this free clinic available both on their website and the Gold Country Media website, which is a publisher of community newspapers in the Placer County area. With only 49% of the Placer County population receiving the flu vaccine, this appears to be an appropriate service for the target population. However, it's difficult to determine how many vaccines are administered at each clinic, and if individuals looking to be vaccinated had to be turned away due to inadequate supply. So for San Luis Obispo County, they offer free drive-through flu shot clinics to anyone ages 2 years and up on a first come, first served basis. The clinic is held only 1 day a week at 2 locations in the county, Atascadero and Arroyo Grande, from noon to 5 p.m. Information about the clinic is provided on the San Luis Obispo County website, as well as in local newspapers. There was no information available on exactly how many vaccines are administered at these clinics. In addition, access to this service is limited with only 1 clinic available during the year. Though this particular service may not be completely appropriate to everyone in the community, those that are retired may find more flexibility in their schedule to access the service. The limited choices of clinics and narrow time frame may not be acceptable service. And with only 50% of the San Luis Obispo County population being vaccinated, even though it's slightly higher than Placer, it appears that this service is not adequate enough maybe to meet the community's needs. We wanted to look at smoking cessation programs in both counties as well. Placer County residents with information, provides residents with information on smoking cessation programs available within their community. Anyone can access these services. Most of the programs are available through different healthcare providers as well. The variety of different programs makes this service easily available to those in the target population. One program requires a small fee of $5 per class, while some of the health insurance providers may cover the cost for others. For instance, Medicare Part B covers up to 8 smoking cessation counseling visits in a 12-month period. Cigarette smoking is a substantial risk factor for pneumonia, especially in those with COPD. Therefore, this appears to be an appropriate service for the target population. With multiple choices of smoking cessation programs available within this county, its residents may find it easy to find a program that fits their needs. So though San Luis Obispo County does not provide their residents with information on smoking cessation programs in their community, this is actually due in part to the COVID-19 pandemic. All in-class, in-class programs are temporarily suspended, unfortunately, but they do offer telephone counseling, text messaging, and a No Butts mobile app that offers quick, tailored help. These services are free of charge and available to anyone. Individuals seeking to obtain information may find them in the San Luis Obispo County website. Telephone counseling may be easier for individuals to access than smoking cessation classes. Like I said, especially during the COVID-19 pandemic, classes required people to attend in person and at set times and dates with, sometimes limited availability. Whereas telephone counseling can be obtained any time of the day, 7 days a week. Text messaging and mobile apps may be slightly problematic for this target population, as many of these individuals find technology difficult to navigate. Therefore, these services may not necessarily be appropriate for them. We also wanted to look at nutrition programs offered in the 2 counties. So, of course, there's CalFresh, which is a nutrition program funded by the USDA that provides monthly food benefits to Californians with incomes at or below 185% of the federal poverty level. And this is actually the largest food program in California. In order to become eligible, individuals must be legal residents, live in the county where they are applying, and meet income requirements. Information about this service and how or where to apply can be found on the Placer County and CalFresh websites. This can be a great service for low-income seniors, as they would not need to pay back this money, nor would they need to report it on their tax returns. So Seniors First is actually a nonprofit group that supplies 1 hot, fresh meal a day, free transportation, and recreation programs to seniors ages 60 and over 5 days a week. Services are offered to individuals or their spouses who are homebound or recuperating from illnesses, hospitalizations, or convalescent care. A small donation is suggested. However, It is not required, and no eligible senior is ever turned away. Information on this service can be found online and on the Senior Resource Guide, which is this guide to programs and services for the Placer County seniors. This program can be a wonderful resource to the target population, and then that it promotes healthy eating, adequate nutrition, and even physical activity, which, as we know, can improve immune function and therefore reduce the risk of pneumonia. San Luis Obispo County also offers their residents information on CalFresh on their website, and also promotes the use of MyPlate, which is a dietary guideline of the USDA. The nonprofit organization Meals That Connect in San Luis Obispo County is pretty similar to Seniors First in that they also provide one hot, nutritious meal to homebound seniors, but they also encourage those that are not homebound to participate in the dining room program. So this program, there's 10 different meal service centers located throughout San Luis Obispo County. Seniors can come together to eat their meals with one another, which kind of fosters community connections and social relationships. Once again, unfortunately, at this time, due to the COVID-19 pandemic, these centers are temporarily closed, and they are not yet sure when they will be able to reopen. In order to qualify for this program, individuals must be at least 60 years old or married to someone who is at least 60 years old. This information can, again, be found on their website. The service is more inclusive than the Seniors First program in that any senior, not just ill or recovering seniors, may benefit from their service. So Britannia went ahead and did our key informant portion of the presentation, and I'll hand it over to her.
All right, so we've covered a lot of data for you guys. There was a lot of graphs, a lot of information, and as you'll see a little later in our presentation by our references pages, there is a wealth of information available, but straight data doesn't tell the whole story. So that's why we like to do interviews. So an interview with a key informant is somebody that's going to have firsthand knowledge of the situation that we're most interested in. So looking at flu and pneumonia in those over 65, we could interview somebody that actually has firsthand experience that's over 65 and has had flu or pneumonia, or interacted with family members that have had it, or somebody in the medical community that might deal with this on a day-to-day basis. So we actually chose, since we're here at Rolling Oaks Community, to speak with their wellness nurse, Jeanette. So her role with the over 65 population is as a wellness nurse. So she helps with preventative measures, getting people vaccinated, helping them get doctor's appointments, medical coverage. It's a multifaceted approach to preventing and not just treating the pneumonia or flu. So we did ask her if there were any services in Placer County that she knew of that would help prevent or treat flu and pneumonia. Amy's already gone over a lot of these services, but it's not just that they're available and they're there and that we found them on the internet. It's important to find out whether the community actually knows these services are there. So she did talk about doing flu and pneumonia vaccines with their primary healthcare provider, local pharmacies. There's also the Placer County Agency on Aging, which specializes in disease prevention, helping people get into CalFresh so they can have that healthier diet. There's also the County Public Health Department, which does put on those vaccination clinics and also has an infectious disease division that looks into outbreaks where we have mass amounts of people getting sick in any given year. So once we talked about what services she was already aware of, we wanted to find out, is there anything that she as a wellness nurse thinks would be beneficial to add on? So one of the most important ones was transportation. So a lot of our elderly over 65 might have a difficult time getting to their appointments or getting to a vaccination clinic, whether that be with their healthcare provider or at a pharmacy or through one of those county put on clinics. So one of the things that we can possibly look at is doing mobile clinics that can come to them. And you're having to find different areas where the elderly actually congregate so we know where to go in order to give them the most access. Another option is doing classes on prevention. So simply educating, whether it's how to keep yourself safe with hand hygiene, how to keep your overall health with a better diet. It's not just access to healthier food, but encouraging them to understand why they should make those healthier choices in their life. Another thing we covered is some barriers. So different things that might make it hard for some of the elderly to access these. She mentioned transportation, health communication, language, or education level. So here in California, we have a very large population who are bilingual, or possibly that English is not a primary language. So making sure that educational materials are available in their language and in common English that's understandable. A lot of health knowledge comes with very technical terms that may not be as easily understood by the older population. Lastly, we went a little more in depth with Rolling Oaks specifically, and to look at how many of our residents here at Rolling Oaks actually do get their vaccines every year. So they had a very impressive 90% get their pneumococcal or flu vaccines annually. So Placer County as a whole, if you remember back a few slides, was only at 49%. So Rolling Oaks is doing much better than Placer County. And our Healthy People 2030 goal is actually to have 70% of our population vaccinated. So we're even beating that. So Rolling Oaks is doing very well at getting their residents vaccinated, helping them get access to be vaccinated, and understanding the importance of why they should do it. With that said, even with this very high vaccination rate, they still do get cases of pneumonia or flu every year. Not very many, less than 5 a year, but it's enough that there's still room for improvement. And so we're going to be looking at a little bit more of what we can do in the community. So what does all of this mean? If we put together all of that data and our interviews, we want to talk about what we actually see happening in the community and then what we think maybe can be done about it. So we see that flu and pneumonia both disproportionately affect our population over 65. Older adults are at an increased risk because of all of their comorbidities, things like heart attacks from stroke, death from flu and pneumonia complications. And the highest risk is actually in those over 85 years of age. When we compare our two counties, even though they had similar demographics, similar population, and a similar rate of vaccination, our flu and pneumonia death rates were slightly higher in Placer County as compared to San Luis Obispo. So we'd like to dig a little deeper into why we think that might be. Both of our counties had lower flu and pneumonia death rates compared to California as a whole, as well as to the entire United States. And in 2019, our hospitalizations due to community-acquired pneumonia were actually lower in Placer County than they were in San Luis Obispo. So looking back at all of that data, we see that our poverty rate in 2018 was significantly lower in Placer County than it was in San Luis Obispo. Placer County has a denser population than San Luis Obispo. The median household income in Placer County is actually higher than that in San Luis Obispo. And educational attainment is higher in Placer County as well. So if we're taking those all together, our Placer County residents, on average, have a higher education, they're making more money, and they have a lower poverty rate overall. So both counties had a very similar flu vaccination rate. It's definitely lower than what we would like for our overall goal, which is that 70%. They were both right about 50, so there's room for improvement. And as Amy covered, a lot of the flu vaccination options are very similar in both counties. The counties put on their own flu clinics, but they have limited hours. They may not be accessible to everyone. And that might be one of the reasons why our vaccination rates aren't quite as high as we'd like them to be. Placer County also has higher rates for cancer, for kidney disease, heart failure, and diabetes, which is interesting considering that we have that higher education level, that higher income level, and yet we're still not seeing a healthier population overall. So looking at all of this information, we'd like to formulate a couple of community diagnoses. So what we think is going on with the community based on what we're seeing, and then some interventions that we think might help. So our first community diagnosis for Placer County is an increased risk of flu or pneumonia among the elderly population related to the dense population, and this is demonstrated by our low vaccine rate. So vaccination rates are still not where we want them to be, and we fall short of it. So we want to know, what can we do to bring that up? Well, we can address this on 3 different levels. We can talk about it at an individual level where we're dealing with a single person at a time, at a community level where we're offering services that possibly affect multiple people, or even at a systems level where we're changing some of our rules or our funding at a much higher level in order to address this. So we came up with a few different ideas that we think would be beneficial to the county. So at an individual level, we'd like to do more education. We would like to have distribution days outside of stores. We can have pamphlets that are printed in very simple, easy to understand terms, available in the languages that most of our people speak in our county. And they explain things like the vaccine options, flu and pneumonia symptoms, when they should seek medical care, and how to stay healthier overall to prevent these diseases. Within our community, we really want to focus on getting those vaccines to be more accessible and available to everybody possible. So expanding those clinics, having mobile clinics that can bring vaccination areas near where seniors live. We would like to coordinate with some of our local hospitals. So we have Sutter, Dignity, we also have Kaiser, and all of them offer these flu vaccines for any of their patrons, but not necessarily ones that they can get to. So that availability is that big problem. And if they can coordinate with us, maybe volunteering time, nursing staff, or even funding to put mobile clinics that can bring vaccines out into the public. Recently, COVID-19 vaccines have been a very big topic, and trying to figure out how to get the most amount of people vaccinated as easily as possible has been a big challenge. There's even been in-home vaccination programs across the state where they have gone directly into residents' homes to vaccinate them where they are. At a systems level, we would like to do more education and information. So with COVID, we've actually been wearing masks, we've been taking our temperatures, we've been self-assessing our symptoms, and that's great specific to that disease. But pneumonia and flu are similar in that they are also respiratory diseases, they are transmittable through the air, and so these same precautions can be applied at a systems level. So you could have mandated screening, such as temperature checks or a self-screening system before entering any facilities that cater to the elderly. So this could be a senior facility, an assisted living, even an independent living facility like here at Rolling Oaks. So we'd like to see those stay around. We'd like to coordinate with the county. So we could go to the county board, present a plan so that it's going to be a similar way of saying it no matter where you are. So if you have a sign that says, check your own symptoms, do not come in the building if you're not feeling well, and we had these across the county, everybody would recognize them. They could look similar, have similar wording, and it would make people stop and think, how do I feel today? Is it worth the risk of being around the elderly population? Hopefully this would reduce some of these. So we do have a second community diagnosis that Amy is going to cover for us.
All right, so community diagnosis number 2 is increased risk of flu or pneumonia death among older adults in Placer County compared to San Luis Obispo County, related to higher prevalence of chronic diseases as demonstrated by higher mortality rates. So as presented in our assessment, while deaths from flu and pneumonia are lower in Placer County compared to California and the US, they are higher than those reported in San Luis Obispo County. Consequently, there is a need for some interventions to decrease this rate and improve older adults' health outcomes. On the individual level, we propose to collaborate with local nurses to design a healthy habits assessment that reviews monthly food budget, physical capabilities, and lifestyle preferences to create an individualized health plan packet that offers affordable and accessible options to the individual to better their health. This may include sample grocery shopping lists for budgeted healthy shopping, sample recipes, a monthly schedule of exercise classes or groups that are appropriate to their abilities and accessible near their living environment. At the larger community level, we can ensure adequacy by holding monthly health events or workshops to educate older adults about healthy nutrition, physical activities, safety management, and disease management by implicating public health nurses, nutritionists, fitness instructors, physical therapists, nurse practitioners, and doctors to improve this population's awareness about the importance of chronic disease management in order to improve their overall health and reduce complications and fatalities from influenza. To increase feasibility and affordability on a system level, states could assign higher costs to non-nutritious foods than nutritious foods via incentives, subsidies, and price discounts for healthy foods. We love our farmers markets here in California, so support farmers market nutrition programs, which provide senior nutrition program participants with coupons for fresh, unprepared, locally grown fruits and vegetables. We'd like to create partnerships and implement fiscal facilitations or incentives for gym franchises and private fitness instructors that offer fitness and aerobic classes designed for older adults to increase availability and adequacy of services for this population. So, first of all, before we open the floor to questions, we really just wanted to thank Jeanette, Pam, Paul, and Rochelle, and the rest of the team here and the staff at Rolling Oaks for all of their help and support and allowing us to be a part of their staff and facility and working with their wonderful residents. Of course, that goes on to thanking all of our residents here for an amazing semester. We are genuinely going to miss everyone. It was such a wonderful experience. And then last, but of course not least, we would like to thank Professor LePage for really just giving us a great experience, pushing us, supporting us, and teaching us everything we need to know about community health and inspiring us every day. So I would actually gonna hand it over to Sam. I would like to open up for questions, but he's the tech guy, so he can facilitate everything for me. So.
Any questions, just go ahead and unmute yourself and we'll answer.
Do you want to turn the slide on?
Oh yeah, I am slideshow.
Are they all unmuted?
I think they can just
They
unmute
have to mute
themselves.
themselves.
if you want.
We don't have everything background noise. Nobody has any questions?
Going once, going twice.
All right, well, we'd like to thank you all for attending our presentation this morning. It has been a real pleasure. If you do think of any questions later, you are always welcome to send them over via email. I know you got the invitation from Pam. If you email back to it, she is happy to disperse those questions to us, and we are happy to get back to you on it. This presentation has been recorded, so it will also be posted for your viewing pleasure if you would like to send it off to somebody else, or if you'd like to rewatch any portion of it.
Just a second.
Something to
No,
check.
yeah, we've got someone in the
Oh,
chat.
we got the chat.
Nothing.
Okay.
Oh,
Not a
shit.
question.
All right, well, again, thank you guys so much for being here, logging on and listening to this presentation. We really appreciate it.
Thank you.
Thank
Take
Thank
care.
you.
Thank you. You want to stop the recording?